Welcome back to Health Fuel Journey, your one-stop destination for valuable health and wellness information. Today, we're going to explore how our diet can impact arthritis. Arthritis can be challenging to manage, but making the right food choices can make a significant difference. We'll delve into 8 foods to avoid and suggest healthier alternatives for a happier, more comfortable life. Arthritis is a chronic condition that affects millions of people worldwide, causing pain, stiffness, and swelling in the joints. Arthritis can be challenging to manage, but making the right food choices can make a significant difference. The foods you consume can have a significant impact on the inflammation in your body, which is closely related to arthritis symptoms. In this article, we will delve deeper into the dietary aspects of managing arthritis, focusing on 8 foods that individuals with arthritis may consider avoiding. So, let's jump right in. Here are the 8 foods you should avoid if you have arthritis. Number 1. Sugar. Refined sugars, such as sucrose and high fructose corn syrup, are commonly found in candies, pastries, and sugary beverages. These sugars can lead to inflammation in the body. When you consume a high-sugar diet, it can trigger a cascade of events that increase the production of pro-inflammatory substances, such as cytokines and adipokines. These substances can exacerbate inflammation, leading to more pronounced arthritis symptoms. Additionally, high-sugar diets are often associated with weight gain, which places additional stress on your joints, further worsening the discomfort and pain experienced by those with arthritis. Refined sugars promote inflammation by increasing the production of pro-inflammatory substances in the body. This sustained inflammatory response can worsen arthritis symptoms, leading to more pain and joint discomfort. Alternatives. For a lower sugar approach, consider natural sweeteners like honey, maple syrup, or agave nectar. These options not only add sweetness but also provide some essential nutrients and antioxidants. Fresh fruits, like strawberries, apples, and oranges, can serve as natural, low-sugar alternatives to processed sweets, offering a healthier way to indulge in something sweet. Number 2. Saturated and trans fats. Saturated fats found in red meat, full-fat dairy products, and processed foods, along with trans fats present in fried and baked goods, can trigger inflammation and raise LDL cholesterol levels. High LDL cholesterol is a known risk factor for cardiovascular disease, which can exacerbate arthritis symptoms. Additionally, these unhealthy fats can lead to obesity, placing extra mechanical stress on your joints. Saturated and trans fats increase the production of pro-inflammatory substances in the body. Elevated LDL cholesterol levels are associated with inflammation, which can exacerbate arthritis symptoms and negatively affect cardiovascular health. Alternatives. To reduce inflammation and support joint health, opt for healthier fats such as monounsaturated fats found in olive oil and avocados, and polyunsaturated fats abundant in fatty fish like salmon and walnuts. These healthier fats can help lower the production of inflammatory cytokines in the body and have been associated with improved arthritis symptoms. For cooking and baking, use heart-healthy options like extra virgin olive oil or avocado oil. Number 3. Red meat. Red meat, especially fatty cuts and processed varieties, is a significant source of saturated fats and arachidonic acid, which can promote inflammation. Additionally, red meat contains purines, potentially elevating uric acid levels and triggering gout, a form of arthritis characterized by sudden and severe joint pain. Red meat can lead to inflammation through the production of pro-inflammatory substances in the body. The presence of arachidonic acid exacerbates inflammation, while purines can increase uric acid levels, potentially leading to gout. Alternatives. Choose lean cuts of meat or alternative protein sources like skinless poultry and fish, which also provide anti-inflammatory omega-3 fatty acids. For those seeking plant-based options, consider tofu, tempeh, legumes, and quinoa as excellent protein sources. Number 4. Dairy. Dairy products may cause inflammation in some individuals with arthritis due to the presence of proteins like casein. This inflammation can exacerbate arthritis symptoms, leading to joint pain and discomfort. Impact on inflammation. Dairy-related inflammation is triggered by proteins like casein found in dairy products. Inflammation worsens arthritis symptoms and can negatively affect overall well-being. Alternatives. Explore lactose-free dairy options, including lactose-free milk and yogurt, or non-dairy alternatives like almond milk, coconut yogurt, and soy-based products. For calcium intake, incorporate dark leafy greens like kale, spinach, and collard greens into your diet. Number 5. Gluten. Gluten, a protein found in wheat, barley, and rye, may worsen arthritis symptoms for individuals with gluten sensitivity or celiac disease. When consumed by those with sensitivity, gluten can trigger an autoimmune response in the body, leading to inflammation and worsening of arthritis symptoms. Gluten sensitivity can lead to an autoimmune response that triggers inflammation. This inflammatory response can worsen arthritis symptoms, making it crucial to avoid gluten for those affected. Alternatives. To avoid gluten, opt for gluten-free grains like rice, quinoa, and certified gluten-free oats. Look for gluten-free versions of pasta, bread, and flour options to create your favorite dishes without gluten. Number 6. Processed foods. Processed foods are characterized by high levels of salt, unhealthy fats, and various additives. These additives can contribute to inflammation and exacerbate arthritis symptoms. Excessive salt intake, common in many processed foods, can lead to water retention and increased blood pressure, potentially impacting joint health and worsening symptoms. Processed foods contain excessive salt, unhealthy fats, and additives, all of which can contribute to inflammation in the body. High salt intake can lead to water retention and increased blood pressure, negatively affecting joint health. Alternatives. To reduce inflammation, focus on consuming whole, unprocessed foods like fresh fruits and vegetables, whole grains, and lean proteins. Read food labels and select products with minimal added sugars, salts, and trans fats. Number 7. Alcohol. Excessive alcohol consumption can lead to inflammation in the body, potentially intensifying arthritis symptoms. Alcohol can trigger an inflammatory response and also weaken the immune system, making it less effective in managing inflammation and combating infections. Excessive alcohol consumption can trigger an inflammatory response and weaken the immune system. This can lead to increased inflammation and more pronounced arthritis symptoms. Alternatives. If you're looking to reduce or eliminate alcohol, consider non-alcoholic alternatives like sparkling water, herbal teas, and alcohol-free mocktails. For those who choose to consume alcohol, moderation is key. Number 8. Nightshade vegetables. Nightshade vegetables, including tomatoes, potatoes, eggplants, and peppers, are considered potential contributors to inflammation and arthritis symptoms in some individuals, although the scientific evidence is limited and mixed. Some individuals may experience increased inflammation and worsened arthritis symptoms when consuming nightshade vegetables. However, the scientific evidence supporting this is not conclusive. Alternatives. If you suspect nightshades are affecting your arthritis, consider replacing them with non-nightshade vegetables like broccoli, carrots, butternut squash, and sweet potatoes. And there you have it, 8 foods to avoid if you have arthritis, along with healthier alternatives that can help you manage your condition better. It's important to note that the relationship between diet and arthritis is complex and can vary from person to person. Therefore, before making any major dietary changes, consult with a healthcare professional or a registered dietitian who can provide personalized guidance. Remember, your diet plays a significant role in your health, and making the right food choices can make a world of difference. Thank you for joining us on this health journey. If you found this information valuable, don't forget to hit the like button and subscribe for more health and wellness tips. Stay healthy, and we'll see you in the next episode.